The virus is not done with us yet.
The COVID-19 pandemic in Indiana. More than 15,000 Hoosiers now dead from the virus, with hospitals at capacity and healthcare workers at a breaking point.
This is a pandemic of the unvaccinated.
With the Delta variant surging, tonight we gather the top health experts from around Indiana and around the country to answer your questions about vaccines, boosters, and the explosion of misinformation about COVID-19.
I absolutely believe misinformation is a public health crisis, and it is prolonging this pandemic.
From Wish TV, this is a News 8 Town Hall. Vaccine Central, presented by Community Health Network.
Good evening to you and welcome to another Vaccine Central Town Hall here on Wish TV. I'm Alexis Rogers.
And I'm Phil Sanchez. For the next hour, we want to answer your questions about the virus surge in Indiana and about vaccines and boosters. It's part of our continued commitment to get you answers directly from health experts about the pandemic.
It's an effort that's been awarded by the Indiana chapter of the Society of Professional Journalists. Tonight, we have some of the top medical officials in Indiana and around the country. We have Dr. Virginia Kane. She's the director of Marion County Health Department. We have Dr. Rob Yaletti. He's the executive vice president and chief physician executive at Community Health Network. We also have Dr. Jerome Adams, Wish TV's medical expert and former U.S. Surgeon General, set to answer our questions.
But we start tonight by talking vaccine boosters with the doctor leading the vaccine programs for the White House. He sat down one-on-one with News 8's Kylie Conway.
Why does it seem like there's so much confusion over who should get it, who's eligible, and why it's needed?
Well, let me just start by saying who's eligible today. So if you've gotten your Pfizer vaccine and your second shot has been 6 months or more, you are eligible for boosters if you're one of three categories. If you're 65 and older, if you are 18 to 64 with underlying medical conditions like diabetes, high blood pressure, obesity, heart disease. And the third category, if you're 18 to 64 and you're an essential worker or you live in institutions that puts you at an increased risk for COVID. So if you're a teacher, you're a healthcare worker, you're a bus driver, you're a grocery store worker, you live at a homeless shelter, you're eligible for a booster shot if you've gotten your Pfizer vaccine. There are about 20 million people in this country who are eligible today to get their booster shots, and there are tons and tons of places where folks can go and get vaccinated, including more than 40,000 pharmacies, 80,000 locations across the country. Now, for people who have taken J&J and Moderna, we are still waiting for that same process that we've talked about with the FDA and the CDC to play out. Both companies, Moderna and J&J, did put out their data publicly, and now we're going to have to wait until full application is submitted to the FDA. FDA review those applications, make a determination. The advisory committee to the CDC review the data, makes a recommendation to the CDC, and the CDC will make the final determination. We do think for people who have taken J&J and Moderna, we'll have a determination by the FDA and the CDC in the coming weeks.
I think it's wonderful how you're explaining how A has to happen before B, C, D, E, and F in order for these to be fully approved, in order for it to go out. I think those steps maybe are what people don't see, and they just see it go from, okay, they're working on this vaccine, oh, and it's approved.
Yeah, I mean, that's why I have so much confidence in the system we have in place. We have a very rigorous process that plays out publicly. You know, the advisory committee to the FDA, the advisory committee to the CDC, those are public meetings. I watch them online, I read reports from those meetings, I see these scientists and researchers debate the data, debate the outcomes, debate the research, and make an opinion. And that's why the American people should be so comfortable with when a decision is being made by the FDA and the CDC. We've made a commitment from day one in this administration. We will always, always let the science lead, let the data lead, so that people are confident when there are those decisions that are made based on the best science, best data that we have available at the time.
Let's bring in Wish TV medical expert and former Surgeon General Dr. Jerome Adams. Dr. Adams, nice to see you. Let's go ahead and start with this. Where are we in this fight against the coronavirus? I mean, are we making progress? Are we anywhere close to where the worst part is over?
Well, I want to start off on an optimistic note. I want people to know that we made tremendous progress. I mean, you've got to remember that this time last year, people didn't think we'd have a single vaccine, and we have 3 vaccines, 1 fully approved, and we're knocking on the door of having a vaccine approved for kids. We have enough PPE for everyone, which is not something that we were certain of last year. And we've got testing that is not as available as I would like, but it is out there. You can find testing if you look hard enough, and if you go to the right places. So I think we've made tremendous progress. Even with this Delta surge, we're starting to see cases level off and go down in most of the country, and hospitalizations and deaths start to level off and go down. So people should be vigilant but encouraged.
Dr. Adams, we were talking about boosters. We've been talking about that a lot lately, and the approval for Pfizer booster shots. Is the push for boosters taking away from getting more people the first vaccine?
Well, that is a great question, and there is a different answer to that, whether you're talking about globally or whether you're talking about nationally. And so here in the United States, we have vaccines that are literally expiring on shelves. And we know from data from Israel, from the UK, that people, particularly who are over the age of 60, do get some waning immunity, and that they would benefit from a booster. So I think it's worth offering the booster to high-risk people, which is what the FDA and the CDC have done. If other people want a booster in the U.S., that's fine too, and they've given permission for people 18 years and up to get a booster if they feel they are at high risk and self-attest, or if they work in a high-risk setting. But to your point, we can't let that distract us from the most important mission, and that's encouraging people who are unvaccinated to get vaccinated. And when I say encouraging, I mean making sure we're giving them the information that they need so that they can make an intelligent choice. And I was really happy to see that LeBron James recently got his vaccine after admitting he'd been skeptical for quite a while. Several other prominent people have finally gotten to the point where they're getting vaccinated. And my hope is that other people will be able to see that and to feel like they can get their questions answered and get vaccinated too.
One question we've heard several times over the past few weeks: can someone who received the Moderna or Johnson & Johnson shot get the Pfizer booster? Should federal agencies be considering the possibility of mixing up the shots?
So I'll go backwards. Yes, I think federal agencies should be collecting data and offering those options to more people. But here's where we are right now. We know that people who are immunocompromised have been advised to get a 3rd shot, whether you got J&J or Moderna or Pfizer. And what the CDC says is if you're in that immunocompromised category, then you can get a booster with any of the mRNA vaccines. That's a smaller number of people. That's different from what the CDC talks about when they say get a booster. And the booster has only been approved so far for people who got the Pfizer vaccine. And right now the CDC says that you should only boost with the same vaccine that you got initially. So if you're in that immunocompromised category, you can get any mRNA vaccine, Moderna or Pfizer. If you are not in that immunocompromised category that the CDC laid out for a 3rd shot, then you're out of luck if you're not a Pfizer recipient at this point. And that frustrates me as much as it frustrates other people out there who got Moderna or who got J&J. Most of all, if you have questions, talk to your doctor and make a decision that's appropriate for you. Your doctor is the best person to guide you as to whether or not you're at high risk and whether or not you should be boosting.
Good conversation there. Dr. Kane joining us now here on set as well. Dr. Kane, we'll go to you first before we talk with Dr. Yoletti, who's standing by as well. How are things looking as we sit here on this Thursday night in Marion County?
Well, I think that they're looking pretty good. We're seeing a definite decline now in our COVID-19 cases. Good. You know, when we look at the amount of transmission in our community, we look at something called a positivity rate. And we had reached as high as 11.7% positivity, and it's already dropped now down to 10.8% positivity rate by 1%. And when we were experiencing over 700 new cases a day, we're down to about 383 cases. So we're making some significant progress.
Percent-wise, what's sorry to cut you, but percent-wise, what do you look at? What percent do you want to be at? What's ideal?
So my ideal is I'd love to be less than 5%. Okay, I think that's really critical. And then when we look at the number of cases we're seeing per 100,000 population, I'd like to see us experiencing no more than about 25 cases per 100,000 population. And I just want to remind everybody that just before the July the 4th holiday, we had a positivity rate of 1.9%.
Wow.
And we were seeing on an average of 26 cases per day.
Yeah.
It was just the perfect setting, and then, wow, Delta came along.
Yeah.
Are you seeing, I guess, percentages in certain communities that are troubling you at all? Because I know we had different targeted communities that we were hoping, would have different impacted and different growth when it came to vaccination.
So I think that you always are concerned about is who's being hospitalized and what different racial and ethnic populations do we see a little bit more of in terms of the cases, but also we try to look at those who are sick enough to be hospitalized. So we're having a higher number of cases in our Hispanic, Latino, X population, but we're seeing a much greater rate of hospitalizations with our Black or African American patients compared to their white residents. Yeah. And here's the interesting, most important point. If you look at the hospitalizations from January of this year all the way up to September the 1st, 98.5% of those patients were unvaccinated.
Yeah.
I think this is a good time to bring Dr. Uletti into this conversation to see how he's assessing these things in the hospital. Dr. Uletti, thank you so much for joining us. We were just talking to Dr. Kane about this. How are you assessing this situation in the hospital as we speak?
Yeah, as Dr. Kane said, things have seemed to stabilize somewhat. As Dr. Kane's back in July in Community Health Network, we had about 10, 15 patients that were COVID positive. We went up to almost 200 patients in our hospital that were COVID positive just a few weeks ago, about 2 weeks ago. Now we're at about 130. So we still so it's coming down a little bit, so I'm optimistic about that. But to kind of echo what Jenny just said, out of the 128 that are positive, 120 are unvaccinated and 8 are vaccinated. So I think that's a very important message, is that, again, this is a pandemic of the unvaccinated, and that's what's filling up our beds right now. It's encouraging that the Delta virus is maybe going through and we're trending down. The hospitals are still very busy, though, because these patients end up staying in the hospital for 2-3 weeks at a time. They're very sick, and they end up staying much longer than what they have previously before.
When it comes to vaccinations, Doctor, are you encouraged by the progress we've seen over the past week or 2 weeks with more people getting vaccinated?
It's been I'm moderately encouraged. I'd like to see it even higher. And the reason I get so concerned about the vaccinations is that we're getting through this Delta surge. The only way we're going to prevent another surge from happening is to get more people vaccinated. That's people either need to get immunity from COVID. So you get immunity either by getting the virus and getting the infection, or getting vaccinated. So the more immunity we have in our local society, the more likely we will prevent another surge. So I'm somewhat optimistic, but I am concerned that we still need to get more people to get vaccinated as quickly as possible to avoid another surge again.
Dr. Uletti, there's been an argument that says, hey, if people haven't gotten vaccinated at this point and they've been eligible, some folks are leaning a little bit more to the other side of saying, hey, I just don't know if I want to get this thing. Are you still having these types of conversations with people who've been thinking about it all this time?
Yeah, absolutely. And I might be a naysayer, but I think what we need to keep in mind, and people are concerned about getting vaccinated and it's an individual choice. I completely appreciate that and support that. The problem we're seeing at a hospital that I'm seeing on a daily basis is that right now in our hospital, as I mentioned, we have 120 beds filled with people that are unvaccinated got COVID. Because those 120 beds are filled, we can't do the general stuff we do for our patients. We're avoiding surgeries. We're avoiding people that have breast cancer by getting their cancer surgeries and colon surgeries because we don't have the beds available. So while it's an individual decision, it's impacting everybody else. So I do understand that, but I'm a strong proponent of mandates of vaccines, mainly because it's affecting every one of us today, even those that are not vaccinated.
Doctor, as you very well know, recently the conversation has turned to booster shots, and it seems as though that conversation has almost taken over the vaccine conversation. Is that someplace we should be going with our conversations around the dinner table rather than the vaccination conversation?
I think the whole issue about booster shots, I think what we need to appreciate is that The only people that need booster shots are those that are vulnerable. And so, again, the 8 patients I have in the hospital today, those are patients that have been vulnerable for other reasons, whether it be their age, diabetes, hypertension. So if you're vulnerable, you should get a booster. If you're not vulnerable, it's okay not to get the booster, because even if you get COVID, will be like a flu-like illness. They'll last for a few days and go away. So dinner conversations, talk to your family, anybody that's vulnerable, whatever their health conditions. If you're not sure you're vulnerable, as Jerome said, talk to your doctor and see if you're vulnerable. But I think the discussion is not just about the booster, but are you vulnerable enough that you need to get the booster?
Dr. Kane, I would love to ask you the same question. You know, is this a conversation that we should be having? Some folks are saying, hey, should we be talking about boosters when there's still so many people who are still not vaccinated?
I think you have to definitely talk about both, to be quite honest and frank. So what happens while you need the booster is that over time, as people get older, their immunity wanes, so it lowers over time. And then there's some individuals who are high risk. Because of this Delta variant, they might need a little bit more protection.
Yeah.
And so they need that booster. So I don't want to, while I'm getting people to be vaccinated on this end, I'm having people maybe not be as fortunate with breakthrough infection because we're not providing enough long-term protection immunity. Remember, we get a flu shot every year. That immunity from a flu shot lasts about 9 months or so, but it's seasonal. Unlike this Delta, which doesn't discriminate, it is here year-round for 12 months.
You heard Dr. Uletti talk about vaccine mandates. Your thoughts on that conversation?
So I'm a strong proponent of vaccine mandates. We are doing it at our health department employees. You know, as healthcare workers, we want to provide some protection for the folks that we're providing our services for. And we've got a very short window of time. And that short window of time is that if we don't get our immunity up to a significant enough higher level, like Ram says, we may be vulnerable again to another variant that may be even more deadly than the Delta variant, and our vaccines may be less effective.
Especially with the winter coming.
Especially with the winter coming, because you can have influenza, flu, and the COVID-19 infection at the same time. And I want to remind people about the pneumococcal vaccine. Pneumococcal pneumonia is the #1 bacterial pneumonia that we see during the winter months. Wow. You get the triple whammy.
Yeah, a lot of people are concerned
the
about that.
triple whammy.
Not good.
So please get that flu shot.
Get yourself vaccinated.
Get yourself vaccinated. Yes, please.
We'll talk more with you momentarily. Dr. Kane, thank you. Still to come, a potential game changer. COVID vaccines for children may be right around the corner, what it means for schools, and the message to parents hesitant on whether to get their kids the shot.
You're watching Wish TV, Indiana's only statewide TV news network.
Welcome back to the Wish TV Vaccine Central Special, joined again by Dr. Virginia Kane and Dr. Rob Uletti.
And we want to spend the next few minutes talking about children and COVID-19, and we'll start with Dr. Uletti here. As we go through this surge of the Delta variant, Doctor, tell us what you're seeing in its effects on children, and are the effects more severe than the original coronavirus?
Yeah, they are a little bit more. Anecdotally, we do see more people, more children getting a little bit sicker with Delta variant than the other variants. That being said, I think it's important that there's still a small population. So on the whole, the pandemic is still predominantly in adults 20 and 30 years of age and older. But we are seeing a little bit more increase with the Delta variant than we saw with other variants, though.
And when it comes to children needing treatment, are we seeing a lot of kids starting to be treated in that way?
Yeah, the children's hospitals are getting busier with this, and so we definitely are seeing more kids being treated. But again, the numbers we need to keep in mind are very small. So we are seeing an increase in numbers, but it's still a very small number of individuals. Luckily, as Dr. Kane talked about, immunity wanes as we get older. So children truly have a very strong immune system for the coronavirus. There's a whole host of viruses that they carry around with them all the time. And in general, they do very, very well. Again, a little bit of an uptick, but still it's predominantly safe for children right now.
I want to add a little.
Go ahead, Doctor. Yes, please.
Don't mind. So for the first time in our history of Marion County, we've seen more cases in children outweighing the number of cases in adults.
Wow.
And so from our K to 12th grade, they're the highest number of cases that we're experiencing. And if you look specifically at those grades, it's our high school students who have the highest cases, followed then by our college students between the ages of 18 to 24. And then after that, our middle school kids. But the thing about children is they can get infected. We may not be seeing as much of the severe complications, but they can transmit the infection. So they can be in a household with an adult that may have an underlying medical condition and put that person at risk.
Right.
So we really have to be concerned about infection spread with our children.
Yeah.
There's a big conversation going on. I mean, I know Phil and I have a lot of friends that are parents, and there's quite a few people out there who say, well, with kids it's just not that bad, so we just shouldn't really be concerned about it. But what's your response to them?
So what I'm going to say is, well, it's not as bad in larger numbers, but we have seen in states like Arkansas, Mississippi, those children's hospitals were overwhelmed in the intensive care unit. And we've seen an increase in our cases in the intensive care unit. So they are a little bit sicker, where they can be admitted to the intensive care unit, placed on the respirator. But the other thing I think that people really need to step back and look at, what are the long-term effects that are associated with our children if they get a COVID-19 infection?
Right.
And so that brain fog may take place, myocarditis, inflammation of the heart.
Right.
So even fatigue syndromes may occur. So we have to look at, we don't want our child to get COVID-19 and then have long-term effects related to the infection.
Down the road, right?
Right.
Yeah. So as you very well know, Doctor, we're getting pretty close to possibly having a federal approval for vaccines for kids, specifically younger kids. And Kylie Conway spoke with the vaccine coordinator for the White House. Look.
What is your advice to parents when they are in this debate? Do I give my child something that may or may not be in their best interest?
Here's how I look at it. You look at the very rigorous scientific process that we have in place before a vaccine is recommended in this country. This is the gold standard process. You have an advisory committee of researchers and scientists and doctors that review all the data, make a recommendation to the FDA. You have outstanding scientists at the FDA that also review the data, take a regulatory action on the vaccine. Then you have another advisory committee of scientists and researchers and doctors for the CDC that also review the data, review the CDC, the FDA regulatory action, makes a recommendation to the CDC. You have the CDC with 15,000 outstanding scientists and researchers that actually also review the data and make a final recommendation. So the process in all of this is being done openly, is being done publicly. You can watch it online if you want to. So we have a very rigorous scientific process. So for me, when that recommendation comes out of the FDA and the CDC, I have full trust in the system that it actually looked at the safety, it looked at the effectiveness of those vaccines, and I would feel very comfortable making that recommendation to my friends who are parents or to my family who are going to be eligible to get vaccinated. So I trust the process. I believe in the science, I believe in the data, and we have a gold standard process in this country for effectiveness and safety of drugs and vaccines.
Just this week, Pfizer announced that it has submitted its data to the FDA for emergency use authorization for children 5 and older, possibly making that available next month. Do you think that is achievable? And to teachers, what do you have to say about how this could change in-person learning and the reliability upon that?
Well, I did hear yesterday that Pfizer did submit their data to the FDA. Remember, they still have to submit a full application. That still has to go through that same process that we've just talked about with the advisory committee, the advisory committees, the CDC, the FDA. And once we get a determination, I will trust the outcome of that determination. I don't have a crystal ball as to when exactly that might happen. I would think in mid to late fall probably, but we'll have to wait and see how that plays out. I think it's really important to know that we have tools in our toolbox now to make sure we're protecting those 5 to 11 years old. And in schools, the CDC has been very clear of what would it take for us to be able to open schools safely in this country. And this is about vaccination, it's about testing, it's about ventilation, and it's about universal indoor masking. So we know what would it take for us to open schools safely. We know what would it take to keep those 5 to 11 protected until they become eligible for a vaccine.
Dr. Adams, we're starting to see data for COVID-19 vaccines when it comes to kids. Do you believe that the shots are safe for kids, and will they be available before the end of the year?
Well, I don't want to get ahead of the FDA or the CDC in declaring them to be absolutely safe. That said, I've seen a lot of the data and I'm encouraged by it. And I believe that they will be deemed to be safe by the FDA and by the CDC. You saw that earlier this week, Pfizer made an announcement that it has submitted its data to the FDA and will be filing for an EUA within days. And you've seen Tony Fauci, Scott Gottlieb, others say that they still feel that we will have a vaccine for kids available by the end of October, by Halloween.
Dr. Adams, what would you say to a parent who is uneasy or even afraid of getting their child to have the vaccine, especially for those parents who say that the virus really isn't bad for young kids?
Well, first of all, I would say that I'm a parent too. And I completely understand where you're coming from. You want to do what's best for your children. And I would advise them to talk to their healthcare provider or make sure they're getting information from a trusted source, not from the internet, not from TikTok, not from Twitter, not from Facebook. As the nation's doctor, as a physician, as a public health expert, I would say to people that the vaccines have gone through a rigorous process to ensure that they are safe, a longer process than what many of us in the health field thought was necessary. And so they've taken more time than what I would have liked to have seen them take to review this data. So when we do get an answer, I will be confident as a physician and as a parent that these vaccines are safe. Now, as far as effectiveness, I think it's important that people remember that, yes, the risk to kids is low, but you don't know whether your kid's going to be the 1 in 100 or the 1 in 1,000. There's no way to predict that. So as a parent, I'm going to do whatever I can to protect my children. But your kids have a low chance of getting into trouble if they ride their bicycle without a helmet, but I'm still going to make my kids wear a helmet just in case. Low chance if they don't wear a seatbelt, but they're going to wear a seatbelt just in case. And if these vaccines are authorized by the FDA, that means the FDA looked at them, determined that they were safe and that the benefit outweighed the risk, and I'm going to get my 11-year-old daughter vaccinated if and when that opportunity comes. Final point I'd make on that is, again, there are social benefits to vaccination in addition to physical and medical benefits. Getting my daughter vaccinated will decrease the chances that she has to miss school this year, that she has to miss a sporting event, that she is unable to participate in things that are part of being a normal kid her age. And so that is yet another and perhaps the most important reason as a parent to get your kids vaccinated so that they can get back to a sense of normalcy in their life.
I want to bring in Dr. Yaletti onto this conversation now. Doctor, specifically in your opinion, how much of a difference will vaccines in younger kids make?
I do have a slightly different opinion on for 12 and above. I feel comfortable. Between 5 and 12, my perspective is that this pandemic is still its reasons a pandemic is because of how it's affecting adults. There are anecdotal evidence for children. I'm not as convinced that although there's rigorous studies, the numbers that are in the studies are still small, and I don't know that emergency use authorization for children 5 to 11 is necessary until we get the full-blown studies all the way to really assess their safety and efficacy. I think if you're worried about if your child has, again, other vulnerable children, if they have asthma, cystic fibrosis, certain conditions, they should probably get the vaccine. But otherwise, it's still in general, I think that the studies need to be really more drawn out. Those studies we have so far are robust, but I'm not convinced that children 5 to 11 need to have a vaccine on emergency use authorization as opposed to full, because again, their risk of getting COVID and getting serious COVID long-term outcomes is still very small. in the pandemic is predominant for adults. But again, I would agree with Dr. Adams is at the end of the day, talk to your physician about it.
You know, that's a very different, viewpoint or perspective that we've been hearing. I would love to ask Dr. Kane, what's your response to that as far as, kids in that age group maybe not getting the vaccine if they don't have underlying health conditions?
So I'm still very concerned about the fact that they could transmit infections. And so they're in a school setting and they're exposed to teachers and staffs who are adults. So if they become infected, they can spread it in their social gathering. They may attend church. They could spread it in a church setting. So I'm a little bit more inclined to really want to get them vaccinated. And I'm only saying that because I'm just looking at the total number of cases that we're seeing. So I'm seeing about 87 cases per 100,000 population for K through 12 compared to adults at about 53 cases per 100,000 population.
What do you say to someone who hears you say that and then answers back, hey, I'm vaccinated though, and yes, I have a child who goes to school, they come home, they bring it to me, I got my vaccine, I'm good.
I just think you still have to worry about, and I would be slightly worried about this, could my child get this COVID infection and they're one of the unfortunate ones that may have a long-term symptoms that are associated with getting that COVID-19 infection, and I could have prevented it with a vaccine.
Dr. Ulati, let's bring you back in. What's your response as you've heard Dr. Kane?
I do think there's a small chance of children, so I do think you need to evaluate it. In terms of, I agree with what Dr. Kane says about transmission, but the way to prevent transmission of the virus from children to adults is to make sure that adults get vaccinated. And so you're right, a child can transmit it to their teachers, to their grandparents or parents, but the ideal way to prevent that transmission is for those teachers, parents, and grandparents to be vaccinated first. The children are a vehicle, but ultimately, if you want to reduce the illness, and one point I might make, although Dr. King is exactly right, is that the predominant positive tests are in children, the predominant admissions to hospitals are adults. So we are seeing a large number of children getting positive testing, but they're not getting hospitalized. So they're getting the virus, they're going to be home for a week or two, and they recover. The thing we don't know, and Dr. Kane is correct, is that how many of those are going to get long-term effects of what we call long hauler syndrome with COVID. So there is that risk. But the best way to reduce transmission of the virus and the pandemic is to help with the children. I think we should do that, but also make sure those teachers, those parents, those grandparents are vaccinated first, even before the children are.
Now, I do want to emphasize one point.
Yeah.
Okay.
And that is, so the children that are 0 to 5 years of age, they have the lowest number of cases compared to any age group. And we were seeing prior, back in April and May, maybe averaging about just 5 or 6 cases per day on a daily basis. It reached up as high as 26 cases per day. So we saw an increase, but that's nothing like the 87 or more cases you would see in high school students. So the most protected age group is the 0 to 5 that we're seeing the least amount of infections that are occurring.
Got that young immunity, right?
Yes.
You know, what can I say?
Absolutely.
Nice.
Maybe inherited from their mother.
Right, of course.
I mean, sometimes that's how we think.
That maternal immunity is
Something
being
else.
transmitted to their babies now.
Yes, hey, girls do run the world, but that's a whole other conversation. The next public health crisis, what is it? Well, type of tougher than fighting the virus, how doctors say the U.S. can overcome it.
You're watching Wish TV, Indiana's only statewide TV news network. This is a News 8 Town Hall, Vaccine Central, presented by Community Health Network.
Welcome back to our Wish TV Vaccine Central special. We're working to make sure that you hear answers directly from some of the top doctors in Indiana and around the country.
These specials are that much more important when you could start to consider the amount of misinformation about vaccines and the virus on the internet and social media. We see them every day. In fact, YouTube has now banned content with false claims about COVID vaccines and booted some of the top accounts spreading those videos. Some parts of the country have now labeled COVID misinformation a public health crisis. We turn again to News 8's Kylie Conway.
Some states are declaring it a public health emergency, all the misinformation that is out there. What is your frustration with misinformation, and how prevalent do you see it is as a contributing factor to people not getting vaccinated?
Well, it is definitely a contributing factor. It is unfortunate that we're seeing so much misinformation out there. And what concerns me is not just the misinformation, it's the scale of the misinformation, it's the spread, it's the sophistication, and we all have a role to play to make sure that people are getting facts, people are getting answers. I can't tell you how many conversations I've had with folks across the country, and even with my Uber drivers today here in Indianapolis. People telling me, well, I've seen a video online about somebody getting paralyzed from the vaccine, or I've seen this, and I've heard this, and I've read this. There's tons of misinformation out there, and we all have a role to play to make sure that people are getting facts.
What are the sources behind the misinformation? Is it genuine people who actually believe this, or is it some sort of sabotage?
I think it's a combination of it all. I think we do all have a responsibility. That's why the Surgeon General issued an advisory to what people need to do to be able to fight misinformation. Any person, before they're forwarding information, it's important we check to see what's the source of information. Is it a trusted source before we start spreading it? Doctors, nurses have a role to play to make sure they're talking out the facts, they're providing the facts on social media, they're doing interviews, they're being quoted in the newspapers. News channels have a responsibility to make sure that we're putting information out there. So we all have a role to play to make sure that accurate information is out there.
So you said trust. I think that I've heard conversations of people saying they just don't trust the information, whether that is from the government or from doctors. I mean, there are some doctors who come forward with conflicting information than their fellow doctors. And so people can kind of pick and choose what they believe, what's closer to their social circle and their circle's beliefs. When it comes to trust, where do you guide people to find factual, scientific information that they can trust?
I would start with making sure you do your own research by looking at the CDC website. The CDC has outstanding researchers and scientists and doctors that actually synthesize the data that's out there, put information at their website. So cdc.gov is always a to-go-to website for me. If you prefer to have one-on-one conversation, I always encourage folks to talk to their doctor. You've trusted this doctor or this nurse with your health for a long time. Please have that conversation with them. I've spent time yesterday with pediatricians and family physicians and town hall meetings, and a lot of the conversations that these docs were telling me that people truly have legitimate questions and lots of misinformation out there that they needed to dispel. And that one-on-one conversation with someone you trust, with your doctor, with a nurse that you know, is really important.
Dr. Adams, do you believe that misinformation about COVID and the vaccines is a public health crisis?
I absolutely believe misinformation is a public health crisis, and it is prolonging this pandemic. And so you have to ask yourself, what can we do about it? Well, one of the things we can do is make sure as individuals, we are going to trusted sources, to doctors, to pharmacists, to the people in our community who we trust on a daily basis to give us medical recommendations, and not to social media, to TikTok, to Twitter, to Facebook. But as government entities, as medical professionals, I feel we also need to understand where people are coming from and reach out to them with compassion. We need to make sure we're answering the questions of women who are concerned about fertility. And I want to be clear that there's been lots and lots of data now showing that these vaccines do not affect fertility. We need to be compassionate with people from communities of color who have historical reasons for being reticent about just believing the government at face value. And if we do these things, if we work together, I'm confident that we can combat misinformation and give people the information they need to make healthy choices.
To that point, and I don't know if you saw this, but YouTube just this week announcing that they're pulling all of their anti-vaccine material. Your thoughts on that?
Well, I think it's appropriate. One of the challenges with these social media platforms is that they like to believe and say that they are ambiguous to the information. They're just a platform for people to post. But what we've seen is that with great power comes great responsibility. And these platforms are making billions upon billions of dollars based on people putting misinformation out there that is killing our citizens. And so I'm glad to see these social media companies having really a serious moment in saying, if we're going to make money off of the American people, then it is incumbent upon us to make sure we're not doing it at the expense of lives out there.
This is a great conversation for us to continue, because misinformation is something that I know we battle here as journalists all the time. And I know that you've probably had plenty of people who have been talking to you about the things that they feel like they know and that they don't know. So let's talk about that. How is misinformation now a public health crisis? And are there any things that pop out in your mind to say, okay, these are the big ones, and let me go ahead and dispel those myths right now?
Well, I think one that we hear about is there's infertility associated with this vaccine. And we've had CDC do a study and look at the number of women who've had miscarriages who were pregnant versus those who were vaccinated, and not a single increase in cases were noted for miscarriages related to infertility. So there's no evidence whatsoever that's associated with the vaccine with infertility. The other thing people sometimes say they have concerns with, I want to know what the long-term effects are 20, 30 years from now. Please, okay? We have had over 195 million Americans receive this vaccine. We have one of the best surveillance for symptoms study side effects in the world. And we've been in this epidemic now almost 2 years, and of the 195 Americans that have received this vaccine, we have not, except for very, very rare, had any side effects that outweighs in any way close to the benefits that we get from the vaccine.
I want to bring Dr. Uletti in at this point, because I'm sure, Dr. Uletti, I'm sure that you have talked to many people about misinformation. What comes to mind for you about some things that concern you that people might believe?
Yeah, I think as Dr. Kane was saying, is that the biggest issues in the younger population, they're worried about long-term side effects, about infertility. I would also have to state, as Dr. Kane said, is that people that are pregnant, if you get COVID, you have actually twice the chance of miscarriage if you get COVID. So people don't understand that they're worried about the vaccine, but you also have to worry, what if you get COVID? And so I think it's very important people understand those differences. I'd also like to bring up, one other point about this misinformation and why it's a public health crisis. Every single day we have over 2,000 people dying. That's like 4 jumbo jets crashing every day. That's like the World Trade Center people dying every day. And the sad part about this, those are all avoidable. So we're seeing about 1,500 to 2,000 people dying every day. That is completely avoidable. That's why it's a public health crisis. And that's why I strongly support mandated vaccines, because we have a way to prevent deaths. And it's just so critical that we educate people and do what we can to really make sure people get vaccinated.
I mean, that's an amazing visual that you just gave us, Dr. Uletti. I don't think that I've thought about it that way, that we have that many people who are being impacted in a deadly way. But Dr. Kane, I'll go back to you here real quick. I saw that as Dr. Uletti was speaking, you were almost up out of your seat.
Well, I would also say that, I get a lot of feedback, and I know Ram gets the same in Jerome, and that is, well, they rushed this vaccine. So I'm concerned about the quality of the vaccine and, is it safe because it was rushed? Well, I want to say that we've been working on, especially the messenger RNA vaccines, for about 20 years. We've been working on that platform. It's just like your car 20 years ago. You may like the same model, but it's not the same car. And so you're doing an improvement every year, but we didn't make any shortcuts where the quality control and the vigorous investigation of the vaccines was shortcutted. What we did was, let's just say, hey, sometimes I may have to stand in the long lines to vote. And so I may be way in the back of the line. But like with this vaccine, it was causing so many deaths. It was overwhelming our hospital systems. We didn't always have enough personal protective equipment, and our healthcare workers were dying. So we said that, wow, instead of maybe this hypertension drug that's up before FDA or this Alzheimer drug that's up before FDA, we're going to move you from the back of the line and put you up first to have FDA evaluate this particular vaccine. But the process that FDA undergoes, that was not shortcutted. And wow, when the people that we had in our clinical trials, we had looking like in the thousands, tens of thousands of people in these clinical trials. And we wanted to make sure that from a racial and ethnic standpoint, that we had enough African Americans in the study, Latinos in the study, Asians in the study, because sometimes different medicines may react differently depending on your race.
So this was not about process, it was more so about priority.
Yes, so it's priority, but also getting rid of a lot of the bureaucratic logistics. The other most important point, real quick, was that they started to produce the vaccine. They said, I'm going to bet the money that this vaccine is going to be approved for FDA. And so instead of waiting until it's approved for FDA and it takes me another 6 months to produce the vaccine, they started producing the vaccine the same time the clinical trial. So we saved lots of time.
And I want to continue that conversation here in just a moment, Dr. Kane. Thank you. Phil, let's go ahead and go over to you to talk about these myth busters.
Well, yeah, there have been a lot of myths, as you very well know, circulating on social media concerning everything from masks to treatment. I want to bring in News 8's medical reporter, Dr. Mary Gillis, to break some of them down. Mary, good to see you.
Good to see you, Phil. Thank you.
First, let's talk Ivermectin. It's been a drug that's making a lot of headlines. What is it? Why people are using it?
Okay, Ivermectin, yes, it is a prescription used in humans, but it is not FDA approved for treating or preventing the coronavirus. What it does is it's an antiparasitic. So what happens is if you have an intestinal parasite or you have something like rosacea or something like head lice, then yes.
Right.
So taking that for the coronavirus, preventing it, treating it, it's very dangerous. And also, it's a medication used in animals. It's very different in the way it's used in humans. So let's not take that. Let's not go there.
Sure. Okay. So let's talk about another rumor that I've seen circulating on social media specifically. Children's oral health declining because they're wearing masks. Any
Right.
truth to that?
Well, okay. This has been dubbed COVID cavities. So the theory behind this is that children are in school, they're wearing masks all day. Their mouth is getting dry. There's no airflow. There's no ventilation. And what happens, what the theory is that the bacteria is building up on their teeth and they don't have saliva to sort of wash out that bacteria. That, too much bacteria is going to lead to cavities, so then the poor dental health. However, if this were true, we'd be seeing people with PPE on, all day, 18 hours working, that they'd be getting the same thing, these COVID cavities, and that's not happening.
Right.
So what we want to do is, there is no truth to this. It's really kids who are at home, they're getting into the snack cabinets, they're not drinking enough water, which is very important in between masking, get that saliva production, get that bacteria out of here, and a routine, brush, floss. Parents, get them on a routine, brush, floss twice a day.
Keep it up.
Keep it up.
All right. Mary, always good to see you.
Good to see you, Phil.
Thank you. All right, coming up here on Wish TV, we're going to continue the conversation. Very important one. Holiday caution, what risks top health leaders say to look out for before making plans, and what's in store for the future with COVID-19.
You're watching Wish TV, Indiana's only statewide TV news network.
Thank you for rejoining us. We're almost out of time, but Dr. Uletti, I want to bring you into the conversation quickly. If you could keep it short and brief. The holidays right around the corner. Your recommendations to folks at home who maybe are going to go visit loved ones in other communities.
I think it's actually very simple. The pandemic is going to be for a long time, but the key word is vulnerability and immunization. So if you're around people that have certain health vulnerabilities, such as age or diabetes or high blood pressure, you need to be more careful. But if they've been vaccinated, then you're safe. So you need to watch for people that have health conditions and watch if people aren't immunized. If you're immunized, then you're safe to go. So if you're going to go for Thanksgiving dinners, Halloween get-togethers, if everybody's immunized, you're safe. If somebody's not immunized, you have to be more cautious then.
Dr. Uletti, thank you. Dr. Kane, really quickly, what's your response to holiday celebrations, how people can protect themselves?
I just think you got to be very careful when you travel and make sure that, for example, if you're on the airlines, you may want to think about not eating or drinking and make sure that you're wearing that mask because you're in a controlled environment. And then know what cities you're visiting, you know, what's the transmission rate in that community. But also for loved ones, check out your vaccination status of who you are visiting, because you may be surprised and make the assumption that everybody's vaccinated when they are not. And even different family members have different perspectives and beliefs about their vaccination. But social distance, wear those masks in public places.
Yes.
Indoors when you can.
Okay.
And that personal hygiene, hand washing at all times.
Hey, holidays might look a little different, but you know, we've been going with the flow. Right?
Moving in the right direction, though, right?
We are definitely going in the right direction.
That's good to hear.
Our vaccination rate is 50%. Guys, we can do better.
Okay. All right. Where do we need to be to get to herd immunity? I have not even 30
You know what?
seconds.
I'd feel a lot more comfortable if we were up to 70% vaccination rate.
So
because
that will
then
be,
I have my natural immunity.
So that will be our goal.
Yes,
There we
that's
go.
our goal. Okay.
Leave us with a goal. I like it.
Now, you guys
Until
better
next
deliver
time.
on
Oh,
this.
yeah.
Yes. Hey, with your help, we can. We'll
Thank
see
you
you
for
next
joining
time.
us. We'll see you back here tonight at 10, 11. Have a great night.